Greetings, my name is Steven Hernandez, and during this video, we will be covering the highlights of my practitioner field study project titled A Medical Service Officer in the U.S. Army. For this project, I interviewed First Lieutenant Melvin Anthony Bonilla. He is a 24-year-old commissioned officer that serves as a Brigade Medical Operations Officer in the 18th Military Police Brigade in Germany. He has been in this position for 2 years, and as a Medical Brigade Operations Officer, he provides oversight of medical readiness and deployability standards for over 1,900 soldiers, to include Department of the Army civilians. The reason that inspired Melvin to choose this career is his desire to help others, and working in medical services allows him to facilitate healthcare for those in need. Primary Healthcare Management Advisor for the Brigade Commander is one of many responsibilities that Melvins will hold in this position. He also plans, integrates, and synchronizes all the Army health system support for our brigade. He coordinates support with medical treatment facilities and medical units at the Role 1 and Role 2 facilities that provides medical coverage to a brigade without comprehensive organic medical capabilities. If you ask yourself what a Role 1 facility looks like, these include the capabilities for providing first aid, immediate life-saving measures, and triage while we are in the field. Now, a Role 2 facility is prepared to provide evacuation from the Role 1 facilities, also includes triage and resuscitation, emergency dental treatment, and treatment and holding of patients until they cannot be returned to duty or evacuate from the theater. He also maintains the unit's medical readiness that is crucial in order for our deployability standards. When we talked about Lieutenant Bonilla's work and strategy, he ensures that him and his team are keeping up with advances in and improvements by maintaining effective communication and relationship with local medical treatment facilities across the bases in Europe, and including the hospital and any other clinics and medical facilities across Europe. He conducts joint training on new techniques or equipment, not only with his soldiers, but with other countries that are part of the NATO alliance. Organization is crucial for Melvin, and he achieved this by forecasting and planning as part of his work strategy. He prioritized work with his battle rhythm, which is similar to what will be for a civilian an agenda, for his daily tasks to allow room to provide time to those spontaneous and urgent tasks that might arise without being forecasted. The most common challenge that Melvin has identified for our brigade as a medical manager is the access to care. This is not only for him, but for most units that doesn't have medical equipment or medical assets organic to the unit. The solution that Melvin and his team has implemented and is being very effective for us is that he conducts multiple coordination with external organizations that provide the support that we require. Melvin believes that the number of staff is a problem that healthcare managers currently face, not only in Europe, but also back in the continental colonies in the United States, since the number of providers that we have, to include also the combat medics, is not enough for the soldiers that they provide care for. Overall, being a medical officer for a military police brigade that doesn't count with the proper medical assets to execute their mission is a continuous challenge for Melvin and his staff. Over the course of practice and performance as a brigade medical officer, Melvin shared that he has learned the importance of continuity of care data. Since personnel are constantly transitioning from positions, it's important to provide a streamlined process for their healthcare. Once he finishes his time in this position, he looks forward to serve as an executive officer for a medical treatment facility in Germany or back in the United States. He also is preparing to take the IPAP in order to be able to become a physician assistant in the near future and continue with his career progression in a medical field. It was a really great experience for me to have the opportunity to interview Lieutenant Bonilla for this assignment. I am grateful for his support and assistance, and I hope that this video contributes to your knowledge and career progression. Have a good day.